Hi, I want to thank APACC for inviting me here. I'm here to talk about the syndemics of mental health issues and chemsex, sexualized drug use in MSM population. I have no conflict of interest to report for this presentation. I will first talk about the syndemics of chemsex and mental health, and then bring in two evidence from Taiwan. One is on the proportion of anxiety and depression in MSM population who engage in chemsex. And the other one is on the proportion of meth dependency among MSM who use meth for chemsex. So chemsex refers to using certain substances before and during sex session for MSM. Specifically, we're talking about substances like crystal meth, methadone, GHB, GBL. And different from generic recreational drug use, these drugs can cause hypersexualization feelings. And you can hear very often for MSM who use these drugs, if you ask them what's their motivation to use this during sex, they will tell you that they want to use this to connect with others. And this is why chemsex is unique. You don't hear heroin users or cocaine users telling you that they use heroin or cocaine to connect with others, but you hear MSM who engage in chemsex tell you that they use this to connect with others. There's a long history that discusses the syndemics health problems in MSM population, including substance abuse, mental health, HIV, STI, etc. So recent papers show that worse mental health outcomes, such as depression, anxiety, somatization, and PTSD are associated with one, MSM who engage in chemsex and those who don't, and two, MSM who use methamphetamine in sexual settings than those who don't, and three, injection drug use during sex, or so-called slamming, than those who never slammed. And that's not all the mental health outcomes that you can see from the literature. There are other mental health indicators that are also associated with chemsex, such as loneliness, sleep problems, lower life satisfaction, and problematic alcohol use. So in Taiwan, we also found high proportion of anxiety and depression from MSM who engaged in chemsex. This data is collected from HERO. HERO was established at the end of 2017. It's a one-stop shop to address chemsex using an integrated healthcare system. HERO provided screening, prevention, and treatment for HIV, and we also provide psychosocial therapy for people who engage in chemsex. Among MSM who engage in chemsex, one quarter of them can be considered having moderate and severe or severe anxiety. And when we ask people to report the proportion of chemsex in their sex life, you can see that those with moderate and severe anxiety have higher proportion than those with mild anxiety. Here you can see that people with moderate or severe anxiety, the red bar, have much higher proportion to use methamphetamine. It's 60% versus 42% for those people with mild anxiety. And it's also the same for GHB, GBL, ecstasy, ketamine, etc. The people with moderate and severe anxiety have higher proportion than those with mild anxiety. This is depression, and we're seeing very similar results in depression as in anxiety. So this provides the evidence from a cohort of MSM who engage in chemsex in Taiwan regarding the syndemic of mental health problems and chemsex. Another evidence from Taiwan is to look at one simple question. Among MSM engaging in chemsex who use methamphetamine, how serious is their drug dependency. And strangely, there is actually very limited evidence for this question. We want to distinguish problematic use. We want to distinguish problematic use from that which is functional or enhancing of sexual experience without negative consequence. So we look at two things. One is the severity of methamphetamine dependency, and second is the factors, the demographics and behavioral characteristics that are associated with methamphetamine dependency. We use data from the COMIS study. It's an online survey for MSM who engage in Chemsex in Taiwan. The motivations for Chemsex are mostly positive. So it's to have fun, to relax, or for intense sexual experience. But among MSM who use methamphetamine, as high as 46% can be considered at risk of developing meth dependency. So we felt like there is a need to increase screening and harm reduction interventions for people who might need help to manage their use of methamphetamine. And there is also, we also suggest that assessments such as severity of dependence scale can be implemented in various settings to help clinicians and counselors of multiple disciplines to identify their clients with potential problematic methamphetamine use and provide appropriate assistance. We also found that there are 4 characteristics that are associated with meth dependency that includes people with lower monthly income, people who practice injection drug use, slamming, and 3, people who constantly feeling lonely, and people whose friends had expressed concerns for their drugs use. So basically, if your friends think that you are a problematic user, then you are probably at high risk for meth dependency. So in conclusion, I think all this evidence lead to one thing. We no longer can address only one question or one problem without thinking about others. There is high prevalence of psychosocial problems among MSM engaging in Chemsex, and this highlighted the importance for multi-level interventions. I think e-health is an interesting and popular channel nowadays to deliver such intervention. Multi-level intervention is not an easy goal to achieve. So far, based on a recent review, there are only 3 e-health interventions that attempted to address the syndemic issue. One intervention addressed both sexual health and substance use, and there are 2 addressed sexual health, substance use, and mental health altogether. Although these interventions are acceptable for MSM, there are still mixed and limited evidence for such interventions and warranted more research. It is important to raise awareness and to encourage e-health interventions that simultaneously address sexual health, substance use, and mental health for MSM. Thank you, and that's my presentation.